Hey, I'm Dr. SCL. I'm a dad, a chiropractor, and the translator you didn't know you needed in this, the first year of parenting. This is Decoded, the first year, the podcast that turns baby brain confusion, mum burnout, and milestone panic into clarity you can actually use. Let's make sense of the chaos by decoding it together. If you ever watched your baby turn their head and notice their whole body respond, an arm straightening, the opposite side curling in, and you've thought, is that just a random movement? I want to gently shift that for you, because what looks random is actually incredibly organised. And more than that, it's meaningful. Last week we talked about gravity, tone, and the tonic labyrinthine reflex. How your baby learns to organise their body against the world. This week, we're layering something new on top of that. Rotation, coordination, the very beginnings of your baby learning to connect their eyes, hands, and their body into one integrated system. And it all starts with a reflex called the ATNR, or the asymmetrical tonic neck reflex. This is one of those patterns that quietly shapes so much of what comes next. Reaching, rolling, crawling, even how your baby begins to visually explore the world. So if you've been wondering why your baby struggles to bring their hands together, or why one side seems easier than the other, you're not missing anything. You're seeing a nervous system that is learning, differentiating and organising itself in real time. And today I'm going to help you to understand exactly what you're looking at so that you can feel more confident, clear, and far less overwhelmed by it all. Last week we explored the tonic labyrinthine reflex, how gravity, tone, and postural alignment are calibrated before your baby ever rolls, sits, or reaches. This week we're diving into the ATNR, the asymmetrical tonic neck reflex, sometimes called the fencer's reflex. When a baby turns their head to one side, the arm and leg on that side extend while the opposite side flexes. It might seem simple, but this reflex is foundational for so many things. Hand-eye coordination, and that's the turning of the head, preparing the hand to track and grasp. A midline awareness, that's the nervous system beginning to differentiate from left and right. Rolling and reaching. The reflex lays the groundwork for the coordinated trunk rotation involved in both of those. And then crawling and eventually walking. The ATNR pattern teaches contralateral coordination, that's opposite sides of the body, the diagonal movements, in other words, upper and lower limb on opposite sides, that we use every time we walk. The ATNR is more than a movement pattern. It's a key step in integrating vision, proprioception, which is the body's awareness or the brain's awareness of where your body is in space, and muscle tone. Here's what we see when the ATNR is well integrated. A baby can roll smoothly from back to side. They can reach for objects across their midline, so they can reach with their right arm across to their left side of their body. They show symmetrical movement patterns on both sides. Symmetry is key within development. And here's what can happen if the ATNR is retained for too long. They have difficulty crossing that midline. Reaching across the body feels very awkward, and this will then be later seen in crawling patterns. They have poor hand-eye coordination, which means they will struggle with feeding, grasping toys, or tracking objects. And you will then see early compensatory patterns appear in rolling movements, sitting postures, and eventually crawling. The ATNR also overlaps within sleep, feeding, and tummy time. And you'll see that with turning the head during sleep can trigger extended limbs, making some babies startle awake. Feeding can feel tricky if one side dominates or the reflex isn't modulated. And tummy time is practice for integrating the ATNR because the baby has to coordinate head turning with arm and trunk stability. So when you notice your baby turning and reaching or struggling to bring hands to midline, you're seeing the ATNR in action, either integrating beautifully or asking for a little bit more practice. As a parent, the takeaway is simple. Quality and rhythm of movement matter more than timing. Please don't try to rush any reflex. Let it mature. Let your baby practice, explore, and build confidence and coordination at their own pace. Next week, we're going to move on to the STNR, the symmetrical tonic neck reflex. That's the reflex that literally bridges crawling and upright movement. So when you watch your baby turn their head, reach for a toy, or attempt to roll, I want you to see beyond the movement itself, because what's really happening is your baby is learning how to connect both sides of their body, how to bring their hands into their visual world, and how to coordinate movement in a way that will eventually support crawling and ultimately walking. And just like we've said so many times before, this isn't something you need to rush. It's something you allow. You allow the repetition, the small imperfect attempts, and you allow the nervous system the time it needs to organize these patterns properly. Because when ATNR integrates well, movement becomes smoother, more symmetrical, and far more efficient. If today's episode has helped you make sense of what you're seeing, if it's taken that question of, is this normal, and replaced it with, I understand what's happening, then that's exactly the shift I'm aiming for. If you're wanting a clearer picture of what's active for your body right now, what reflex might be driving their movement, and how that connects to milestones, you can download the Baby Milestone Decoder. Simply send me a DM through the socials and I'll flick you a copy. I'm particularly on Instagram at Mount Hawthorn Chiropractic. When you send me a DM, send the word Decode. Next week, like I've mentioned, we're stepping into the STNR, that reflex that bridges the gap between the floor and upright movement and plays a huge role in how your baby transitions into crawling. Dr. SCL, out. Thanks for listening to Decoded, the first year, where we translate the mess of early parenting into something that actually makes sense. Be sure to share this episode with a friend, a partner, or a mum that you know who is quietly struggling through the noise and secretly Googling every milestone. If you want to hear more decoding, follow at Mount Hawthorn Chiropractic on the socials. Let's keep decoding the chaos. No mansplaining, no pressure, no judgment, just clarity when you need it most. Please note, this podcast isn't medical advice. It's just smart strategies from a Gonstead chiropractor, a dad, and someone who's been in the room with hundreds of mums trying to make sense of their baby's development, their own postpartum recovery, and the constant noise that comes with modern parenting. Always chat with your health team for specific care.